I'm happy and grateful to introduce Dr. Rae, who has been very important part of evolution of our conference. You've been always supportive, you've always participated either as a vendor or as a speaker or as a participant. Tell us a little bit the path that brought you from wherever you started to what you're doing right now.
So it's been a lifelong journey of exploration into health and healing, and basically what brought me to my profession, which is naturopathic medicine, was just a dissolution in how society views health and healing, in particular from a human sovereignty perspective and a choice perspective. So what I was seeing around me is that people didn't really have a choice in terms of what they wanted to do to heal. And then I was introduced later in life, actually, when I was actually in naturopathic medical school. This was not part of our naturopathic curriculum, to psychedelic medicine on a personal level. And that led me to come to the very first Spirit Plant Medicine Conference. I can't remember what year that was. It was 9 years ago.
Yeah.
9 years ago. And that was a really
2010.
amazing event for me, because that's where I met my one of the most important people in my life, Helen Lashny, who has become a dear soul sister of mine, and with who I ended up opening Empower Health Clinic, which then became a very a central organization or community hub for people in the psychedelic community. And we haven't ever offered psychedelic medicine in Empower Health Clinic because of for legality reasons, but we've always been there in the community supporting and waiting for the day when one day they can be offered. And in the meantime, just helping people before and after experiences, ensuring safety, all that kind of stuff. And really, what it's more been about than just the actual medicines themselves is actually been about the creativity that emerges after people go through psychedelic experiences. So for Helen and I, who had our own personal journeys with these medicines, Empower Health was actually the birth of that vision. It was about community, it was about unity, it was about that network of that constellation or that web of network of people that are there to support us, and tapping into that as a business. So that's a little snapshot into my journey that led me here. So
yeah, and I remember you contributing at the beginning of our conference, putting lots of emphasis on post-ceremony and holding space and helping people who may have not had the best experience during the ceremony. And they went to Peru, they went somewhere, they had 2-3 days of extremely powerful experience, and they come home and they don't know what to do with it.
Exactly.
And your clinic was the landing place for many people like that.
Exactly, and I think we had perhaps a bit of a maybe an more of a view into the negative experiences that people can have with psychedelic medicine, because we're a place of healing. So I've definitely treated patients that have come out of experiences and had very big existential crises right through to psychotic episodes, and so not suggesting that this is a common thing, but it's common enough that it's awareness is really important.
Exactly.
And I think that the main thing that's lacking in the community, and this is, again, it's not because the community is lacking, is that the societal framework in which these medicines are offered is lacking. Because these things are illegal, people are forced underground, and it's really difficult for people to know what therapists and medical professionals are there that can be understanding and non-judgmental from having had these experiences. So I think what Helen and I have created was a space where people could come and see health and wellness professionals who are sympathetic to the experience that they've gone through, and really help them get healthy again if they've had a bad experience. And even if they've had a good experience, how do you actually integrate it? How do you actually create something from that, improve your life? Yeah.
Beautiful. Well, thanks for that work. That was very important, and thank you for bringing it to our awareness so we can include discussion about it during the conference. And right now, I know you spent lots of time, and you created this amazing group of people that I was invited to be part of to start conversation about ketamine, use, healing or medicinal use of ketamine. Tell us a bit more about that.
Yeah, so ketamine sort of came on my radar as a medical professional. I'm a naturopathic doctor. I'm not actually allowed don't have prescriptive authority to prescribe ketamine, but as a clinic owner and a director of wellness, integrative wellness programs, I deal with all kinds of health and wellness practitioners. So I, of course, have colleagues and friends in the regular medical field who were interested in and already prescribing ketamine. And what I learned, what I was very surprised to learn, was that ketamine, which is a dissociative anesthetic and a pain medicine in the regular medical world, actually has psychedelic properties. And then when I really dug deeper, I was like, this stuff is actually being used in the psychedelic community, in certain segments of the psychedelic community, since the 60s. So there's actually like a whole history of use here as a psychedelic. And I had the fortune of being able to try this in a therapeutic setting. And I was blown away by the experience, and I thought, wow, this is a shorter acting psychedelic. It in general doesn't bring people to those really intense bad trips that a lot of the other psychedelics do. It doesn't have residual side effects like the next day like a lot of them do, and it also does not interact with SSRIs and other serotonin medications or serotonin system influencing medications. So what that does is it really is allows its use in a psychiatric or psychological setting where people have conditions where they are on medications that wouldn't allow them to use like other psychedelics. So really what the potential for ketamine is that it actually is allowing for some very breakthrough psychotherapy. It's a very breakthrough psychotherapy methods to allow access to people that don't have a lot of access to these medicines otherwise. So I think there's a lot of potential there. So what we've done, it's not just me, it's a lot of other people across professions, across the medical professions, who have really joined together to discuss and brainstorm and research and come up with research protocols, ethics, guidelines, policy recommendations for the use of ketamine in a psychotherapeutic setting. It is currently an off-label use if it's used that way. And what's really cool about ketamine is that it is already approved in the U.S. for depression, treatment-resistant depression specifically, and there's a really long history of safety data. So it really wouldn't actually take much to have this become accessible to people, and again, it's just another tool in the toolbox. So we know that there are different properties that all the psychedelics have, and you can look to the research for that. And ketamine also has its specific set of circumstances where it shines. Yeah.
And I wanted to acknowledge and express my appreciation for the way you're going about doing that, inviting practically every person that could add to the conversation to address every potential outcome from every legalities, ethical considerations, health considerations, all of it combined before anything is actually being implemented.
Absolutely.
That's an amazing work, and thank you for that, and thanks for always being here to contribute and support our mission.
Absolutely, and for people that want to find out more about this group that's organizing, if you go to www.capbc, that's kapbc.org, you can sign up to receive more information. In particular, we're looking for professionals, medical professionals, but actually anybody can join if they want to find out more information about that.
Beautiful, and they can find you there as well too if someone wants to specifically contact.
Yeah, you can find me multiple ways. Through the clinic that I work for, as well as through BC Cap, and I mean you can find me on Facebook. I'm everywhere. So
beautiful.
Yeah.
And they can find you here.
And you can find me here at the Spirit Plant Medicine Conference. Yes.
Thank you so much.
Thank you.
Thank you, Rae.
All right, thanks.